More than 10,000 people have died in Italy due to coronavirus, and the death rate there is higher than anywhere else in the world. In this video, we'll talk about the reasons why that might be the case and what we can learn from this. Italy is a developed country with a world-class healthcare system, so it's quite surprising that their case fatality rate from coronavirus is so much higher than the rest of the world. As of right now, their case fatality rate is estimated to be about 8%. That sits starkly in comparison to that of China, which was the original epicenter of the coronavirus with a rate of about 4%. And with South Korea's rate of less than 2%. In today's episode of Life Prescription, we're going to talk about why Italy's coronavirus case fatality rate is so high and what are the lessons we can learn from this tragic situation. You can find the timestamps for each section of this video by clicking the description below. You can also find the sources I've used to make this video by clicking the description. Let's start by talking about calculating case fatality rate. To get it, you divide the number of people who have died due to coronavirus by the number of people who have the coronavirus. And by doing the math, you get the overall case fatality rate. Let's talk about the numerator in this equation, the number of people who have died, to see if we can figure out why Italy's fatality rate is so high. Advanced age is a possible risk factor for serious illness due to coronavirus. Italy has a population of about 60 million, and 23% of Italians are over 65 years old. Italy has one of the highest concentrations of elderly people in the world, second only to Japan. When we compare case fatality rates in Italy and in China, the rates of people aged 0 to 69 are actually quite similar. The difference in rates of people over 70 and especially over 80 becomes very apparent. Additionally, the fatality rate in people over 90 is about 23%. Which is nearly 1 out of every 4 people. One heartwarming story out of Italy is 102-year-old Italica Grandona. She spent 20 days in the hospital due to coronavirus and is now recovered. She can now brag that she has lived through both Spanish flu and through coronavirus. So it may be that age distribution in Italy, with a much higher proportion of older people, is contributing to the higher average case fatality rate. Simply put, the numerator is bigger. Perhaps the higher percentage of older people in Italy explains the high fatality rate. As we said, the numerator is bigger. But is it actually? Let's examine how the numerator, the number of deaths due to coronavirus, is defined. It turns out death due to coronavirus doesn't have a strict definition. It's defined as a person who's died and who's also tested positive for coronavirus. It doesn't take into account how sick you were to begin with, or the reason you came to the hospital in the first place. For example, in a sub-analysis of 355 patients with the coronavirus who died in Italy, the average age was 80, and almost 50% of these patients had 3 or more underlying medical conditions. This confuses the picture. If what constitutes death due to coronavirus is not the same universally, then the numerator in our equation is going to have a lot of variability. Alright, enough about the numerator. What about the denominator, which is the total number of people who have coronavirus? The first death in Italy took place in the small town of Vo, which is near Venice. The reaction to this death was to isolate and test the entire town. In doing so, they found that a majority of those that tested positive did not have any significant symptoms. This highlights the need for strict isolation and social distancing policies because people who have no symptoms at all could still be spreading the virus. However, soon after this initial period of extensive testing, Italy transitioned over to testing only the people who sought medical care. This was likely done because the healthcare system became overwhelmed. As a result, people with no symptoms or with mild symptoms would not be included in the denominator, and the denominator is therefore lower, leading to a higher case fatality rate. In conclusion, the number of people who have died in Italy is beyond a tragedy, but the numbers we have may not be telling the whole story. Because the age distribution of Italy skews towards the elderly, and because the people who are getting tested tend to be sicker, we can't know the true fatality rate there. One thing we can take away from the Italian data is that older people are much more likely to have serious complications from the coronavirus, and because of that, we should be doing everything we can to protect them. That means really strict isolation and social distancing policies. It also means we have to help out those who are vulnerable and can't get around as much. If you have a loved one or a neighbor who falls into that category, reach out and see if there's something you can do to help. For example, getting their groceries or their medications. We have to remember that every single person in the entire world is going through this. and we have to be there for each other. We can and we will get through this together. If you found this video helpful, please consider hitting the like button and subscribing. I'm trying my best to reach as many people as I can so we can all be prepared during these crazy times. And hitting the like and subscribe buttons will help other people find this video. Until next time, stay safe, stay well, and I will see you soon. If you're still watching, bye.